before I review for the exam next week. And it's regulation of blood calcium levels. This is something that you absolutely have to understand. Okay, it's not just for me. You can't memorize it and dump it. You have to keep it in your brains. Okay, we're going to talk about it again next semester. They're going to be talking about it in core. Okay, so I really want you to understand it. Calcium regulation. So what happens with calcium regulation? It helps maintain constancy of blood calcium levels. It is so important that we have just the right amount of calcium in our blood and just the right amount of calcium in our bones. If we don't, it results in devastating effects, right? And when we do our fluid and electrolyte pathology workshop, the one I said, it's just voluntary, you're gonna see how important it is, because if our patients' calcium levels get too low, or if they get too high, in either case, they can go into coma and die. Okay, so it's very, very serious. But, when we're healthy and everything is working properly, the normal physiology will help us maintain calcium blood levels. And, we don't have any problems unless there's a pathology. So, during bone formation, osteoblasts remove calcium from blood and lower circulating levels. Okay, they remove calcium from blood and lower circulating levels. During the breakdown of bone, osteoclasts release calcium into the blood and increase circulating levels. Okay, I want you to commit that to your memory. And I'm going to show you a visual in a minute. So the skeletal system serves as a storehouse for about 98% of the body's calcium reserves. Calcium is mobilized and moves into and out of blood during bone remodeling. Homeostasis of the calcium ion concentration is essential for bone formation, remodeling, repair, blood clotting, transmission of nerve impulses, maintenance of skeletal and cardiac contraction. But just to give you how important this calcium is. The primary homeostatic mechanism that regulates blood calcium levels involve the secretion of the parathyroid hormone by the parathyroid gland and the secretion of calcitonin by the thyroid gland. Okay? So the thyroid gland and the parathyroid gland are antagonists of each other. Right? Remember we talked about insulin and glucagon being antagonists of each other? Well, these hormones they work the same way. They're antagonists of each other. The thyroid gland is going to release calcitonin if calcium levels in our blood is too high. If calcium levels in our blood is too low, then the parathyroid gland is going to release the parathyroid hormone. Okay? This is the easiest thing in medicine, I think, because if I ask you, what hormone does the parathyroid gland release? What are you going to tell me? The parathyroid hormone, right? I mean, that's about as easy as it gets. Okay? All right. So I want you to know that the parathyroid hormone is the primary regulator of calcium homeostasis. Okay, the parathyroid hormone is the primary regulator of calcium homeostasis. It stimulates osteoclasts to initiate breakdown of the bone matrix so that it can increase blood calcium levels. Now that makes sense, right? Because I said that the parathyroid hormone is going to be released when calcium levels are low in our blood, right? So that makes sense that the parathyroid hormone is going to stimulate osteoclasts to initiate the breakdown of the bone matrix. And by doing that, it's going to increase blood calcium levels. It increases renal absorption of calcium from urine, and it stimulates vitamin D synthesis. This is why if you have a patient that has low vitamin D, well, not only will the doctor put them on a vitamin D supplement, but they usually will put them on a calcium supplement as well, like some type of coral calcium, a liquid that they can actually drink. Okay. So vitamin D synthesis increases the efficiency of calcium absorption from the intestine. The parathyroid hormone is the most critical factor in homeostasis of blood calcium levels. The parathyroid hormone enables bones to remain strong and calcium levels to stay within normal limits during bone formation and reabsorption. All right, my nurses, here's another negative feedback loop. Okay, this is normal physiology. This is what should be happening as you're sitting there right now. Your body is regulating your calcium levels. Okay, now let's pretend that right now our calcium levels are a little too high in our blood. Okay, well, it's a negative feedback loop, right? So we want to oppose that change. We want those calcium levels to go back to normal. So what's going to happen when calcium levels are too high in the blood? The thyroid gland, you see this pink gland here? Okay, it's going to secrete calcitonin. Calcitonin. And this calcitonin is going to cause a decrease in the breakdown of the bone matrix. So if we don't have the bone being broken down as much, then we're going to have a decrease in the calcium levels of the blood. Does that make sense? Okay. So that's the first thing here. For calcium levels that are high. And what's it called, by the way? What's the medical term if it's a pathology? It's called hypercalcemia. Hypercalcemia. Don't confuse it with hyperkalemia. What's kalemia? Potassium. Okay, so hypercalcemia. Okay, let's come over here now. Now we got the opposite going on. Now we have too little calcium in our blood. What's going to sense it? These parathyroid glands. We have we have 4, some people have 5, believe it or not, and they lie right on top of the thyroid. So the parathyroid gland is going to sense that the calcium's low in the blood. It's going to secrete the parathyroid hormone, which is going to increase the breakdown of the bone matrix, and that's going to make the calcium levels rise in our blood. Yep, negative, both of them are negative feedback loops. And they're antagonists of each other, just like glucagon and insulin, right? If glucagon is too high in our blood, what kicks in? What hormone? Insulin. If it's too low in our blood, what kicks in? Glucagon. Okay. This is doing the same thing, but we're talking about calcium. And we're talking about two different hormones. We're talking about calcitonin, and we're talking about the parathyroid hormone. Are we okay with this? So you always want to remember, if I ask you on the test, what does the thyroid gland release? What hormone? Calcitonin. Now it releases other hormones, but we're not going to worry about that yet, okay? We're going to take it step by step. So the thyroid gland secretes calcitonin. The parathyroid gland secretes parathyroid hormone. Calcitonin, parathyroid hormone are antagonists of each other. So you want to know, when does the thyroid gland secrete calcitonin? Yes, when calcium levels are too high in the blood. And this is what it's doing right now as you're sitting there. Now let's say your patient has a pathology. Let's say they have osteoporosis. Well, what happens in osteoporosis? The bones become what? Brittle. So this negative feedback loop will still try to work, but it won't be as effective, right? Because now there's a pathology. However, what can we do for our patients that have osteoporosis?
Weight-bearing exercise.
Weight-bearing exercises, but we can also give them calcitonin. It comes in a nasal spray. So, we have something now that we can treat osteoporosis with. Yes?
So why is it that when you have issues with your parathyroid, you have an elevated calcium level?
If you're, well, yeah. Remember, and it's a very, very good question, but I want you to think about something. So, let's say that the patient has parathyroid cancer, let's just say, and we have to remove 3 out of the 4, okay? And the last one is kind of suspected, or it's kind of iffy, right? That it may have cancer too. We'll remove that one. We'll remove the remaining one and we put it in the arm so that it will continue to work. That's how important these parathyroid glands are. But if they're not working properly, why would we have an increase in calcium? Because what is the job of the parathyroid hormone? It's to increase the breakdown, right? So that you would have more calcium in the blood. But it's not doing that now. But what is happening to the thyroid? What is happening to calcitonin? Remember, it's like insulin and glucagon. When we think of diabetes, we think, oh, it's just an insulin problem. The glucagon's working okay, right? It's the insulin that's messed up. That's not true. Because they're antagonists of each other, they both have to be working at their optimal best. If they're not, then it affects the other hormone as well. So it's going to affect the calcitonin, right? And what's the calcitonin's job? It's to decrease the breakdown of the bone matrix. Well, now, the calcitonin and the parathyroid hormone, it has no one to spar with, right? Because they're antagonists of each other. So this isn't going to work either. Or it's not going to work as efficient, so we see the spike in the calcium levels. But that's a great question. I want you to think of these hormones, and I think I mentioned it before, as boxers, right? When boxers are training, they use that punching bag. It's great because it increases their speed and it really helps them. But in order for them to really be at their optimal best, they have to fight with an opponent, right? And that's the same way with these hormones. When you have a parathyroid, or even a thyroid problem, if you have a thyroid problem, it's just not your thyroid anymore. It's the parathyroid that is affected too, because of the hormones that they produce. Does that make sense? No? Yes? Yeah? So a friend of mine had parathyroid cancer, and when she was diagnosed, she was in her 50s. She was postmenopausal. So when they did the blood work and they saw the high calcium levels, what do you think they told her? They said, you have osteoporosis. You know, they gave her all these weight-bearing exercises to do, and they gave her calcitonin. She went back in 6 months later, whatever it was, and the calcium levels were through the roof. And they're like, what's going on? Well, then they, did some more thorough testing, and they found out she had parathyroid cancer. And remember, the parathyroid hormone is the primary regulator of calcium regulation. Okay? If we lose our thyroid, what do we do with that? We can give medication, right? We can treat it, we can keep the calcium levels okay. Parathyroid glands, man, it's really tough when we lose this, especially if we lose them all. It's very, very tough to control those calcium levels. What would make calcium levels low in the blood, do you think? And this isn't really a pathology. When you have a mom that's lactating, all the calcium goes to the baby. So if it wasn't for this negative feedback loop, mom would be suffering from hypokalemia all the time. But she's not, because the parathyroid gland secretes more of that parathyroid hormone, and it's going to cause the bone matrix to break down more, and it brings our calcium levels back up. So it's really neat how the body takes care of itself with these negative feedback loops. The only time, like I said, the only time it doesn't is if we have a pathology or something out of the ordinary, like nursing, because it's not something you do every day for the rest of your life. So, any questions on this? So calcitonin is a protein hormone produced in the thyroid gland. It's produced in response to high blood calcium levels, stimulates bone deposits by osteoblasts, and this I've already said. I mean, it's just a nasal spray containing calcitonin is available to treat postmenopausal osteoporosis, along with those weight-bearing exercises. Calcitonin plays a significant role in homeostasis, but it's far less important than the parathyroid hormone. Any questions at all on this?